Welcome back to the Atlanta Fibroid Center YouTube channel. While we're most known for our pioneering work in the non-surgical treatment of symptomatic uterine fibroids, there are a number of other medical conditions that we treat at the center. The common theme being these are medical conditions that are either seen exclusively in women, like uterine fibroids, or at least predominantly in women. One of the conditions that is predominantly seen in women are migraine headaches. And we treat migraine headaches at the center. It is much more commonly seen in women than men, although we will treat men at the center. When someone is suffering with migraines, they will often seek multiple different opinions, be on multiple different regimens. There hasn't been a specific treatment for migraines that will work in every patient. And so patients, particularly those that have chronic very frequent migraines, at least 15 or 20 a month, will often go from doctor to doctor trying to find something that will work for their pain. One of the things that we found that works very nicely is what's called a sphenopalatine ganglion block. Now that's a very long and difficult name, but it has to do with a specific ganglion that is responsible for transmitting pain along a pathway back to the brain. It involves the fifth cranial nerve. There are 12 cranial nerves, but this specific one involves the fifth cranial nerve, which is something that innervates the face. And so not only will it be helpful for migraines, we will also treat patients with dental pain, facial pain, even TMJ. And so how do we treat with a sphenopalatine ganglion block? Well, we take a very small catheter and insert it into each nostril separately and inject some liquid lidocaine into the nostril in a specific location. And that lidocaine will then drip down onto the ganglion itself, and we'll have the patient hold their chin in a certain position, trying to hold as much of the lidocaine for several minutes before eventually swallowing it all. So we're getting a topical anesthesia of this ganglion in the hopes of it will break the cycle of pain that the patient is going through, most notably for these chronic migraines. Now the patient may have to come back for at least 2 and possibly 3 sessions of this treatment. The treatment is very simple and very quick. Patients will drive up to our center and drive themselves home. So there's no recovery afterwards. The procedure takes anywhere from 8 to 10 minutes. So the entire time they're at the center may be 15 minutes. So it's a very quick procedure. It doesn't involve any needles. The procedure is done under X-ray guidance. And so again, a tiny catheter is placed into each nostril. A topical anesthetic is given. The patient kind of holds that topical anesthetic, and then they will get up and leave. So I wanted to show a representative sample of what the sphenopalatine ganglion block looks like. This is a schematic. To orient you, the patient is lying flat on their back with the nose at the top of the image here, and you can see the nostril, the opening of the nose here, and a blue catheter coming in, and at the end of the catheter, a lighter pale blue catheter is placed inside of it. It has a little kind of hockey stick, and we are advancing it to a specific location above the middle turbinate of the nose to inject liquid lidocaine, and this lidocaine will topically anesthetize the ganglion below. You can see the end of the catheter here, the lidocaine is liquid and it's bathing the ganglion down below. We have the patient have their chin up to try to trap as much of the lidocaine on the ganglion as possible. So we let it sit there for about 8 minutes, 8 to 10 minutes, and then the patient gets up off the table and leaves. There's no recovery after the procedure. This procedure is covered by insurance. It's a very inexpensive treatment that can be repeated. Usually once the migraine has been broken and the patient no longer experiences migraines, it will last, the effect lasts for typically 3 to 4 months. So you can imagine the patients that we see often have at least 10 to 15, if not more, migraines each month. They will go oftentimes 3 or 4 months without a migraine.